Welcome to episode 19 of the Imagine Your Future podcast. I'm Steve Hall, your host for this episode, and I'll be joined by my co-host and colleague Karen Collier in early 2021. I've been working in technology for over 30 years, 15 of those with ISG, and now lead our European business. Our aim with this podcast is to inform, educate, and engage our audience on technology and digital-related topics. We have a great lineup of senior execs and thought leaders for various industries scheduled throughout the year, so please subscribe and stay tuned on LinkedIn and other social channels as we continue to expand the podcast. In this episode, we are honored to have Dr. David Howie as our guest. Dr. Howie is the Chief Commercial Officer at the NHSX. This organization is the technology and enablement arm of England's National Health Service. Their mission is to deliver the Health Secretary's tech vision and the NHS long-term plan in England. In fact, NHSX, where X stands for user experience, is leading the largest digital health and social care transformation in the world. NHSX has 5 primary goals, all focused on making things better for patients and the staff of the NHS. The number one goal is to reduce the burden on the NHS workforce so they can focus on delivering care. Give people the tools to access information and services directly so they can best take charge of their own health and care. Ensure information about people's health and care can be safely accessed wherever it is needed. Aid the improvement of safety across health and care systems. And finally, improve health and care productivity with digital technologies. As you can imagine, the NHS has been hyper-focused on the COVID-19 pandemic over the last 6 to 8 months. Dr. Howie and his team were on point for the UK's Test and Trace app, which has over 10 million downloads as pubs and restaurants across the country required the app before patrons could enter. Dr. Howie is no stranger to high-stress roles, though. Prior to joining NHSX, Dr. Howie led the UK's Home Office commercial division through Brexit and aligning the UK's immigration systems and ports of entry with Brexit guidelines. So, David, welcome, and take us through a little bit of your government career so far. Your time at Home Office was fascinating, and I know you just joined NHSX in 2020. So, talk about jumping from the frying pan into the fire. Share your journey a little bit.
Thanks, Steve, and good to be here with you. But of course, we're doing this over the internet. I'm in southeast London, and I imagine you're in your bunker in Denver. So good to be here, at least mediated over the internet. So yeah, it's been an interesting journey for me. I spent the bulk of my career in the private sector, mostly in management consultancy, up to about 5-6 years ago, and then I joined the UK's Home Office, which is the government organisation responsible for very, very broadly keeping the citizens and the borders safe. So that's everything from responsibility for the police, for counter-terrorism, for the border force, for immigration, for visas, for passports. It's a really, really broad remit. And my responsibility there was I was responsible for how we procured and managed the relationships with the third-party service providers we used to deliver tech and digital. And increasingly also, as you mentioned, I took on responsibility for the commercial approach and the sourcing approach to how we prepared for Brexit. And, in the tech and digital space, the bulk of our spend, the overwhelming bulk of our spend was with third-party service providers. So having a procurement and commercial and sourcing role was significant because it enabled me to have a significant part in actually how we thought about our technology and how we tried to move away from legacy systems to build more future-proof, architecturally solid, enterprise scalable and digital services. Now, I don't know the last time you renewed your passport. Well, you won't have renewed a UK passport, of course, because you're not a citizen. But if you do, it's a remarkably seamless experience. You can do it from your own home. You don't have to go and pay money to put it in a PhotoMe booth anymore. You can take a picture of yourself on your phone or your iPad, and you can submit your application within a few days. Often we get people's passports back to them. And we did something similar around the settlement scheme, where we quickly went out to market and we worked with a whole bunch of service providers to build an online app which enabled us to process the 3 or so million EU citizens in the UK and give them settled status, indefinite leave to remain. And that was a pretty exciting thing. And nothing's really been done at that scale and at that speed before.
Yeah, I would second that, David. I mean, with all my world travels, certainly coming in through Heathrow and coming in through immigration is just so seamless. Even with my fast pass and my UK work visa, it's just been so easy to get in and out of the country in a really seamless way. So well done.
Yeah, and we're having more success with e-gates, and the aim there is to roll out more e-gates and put a larger flow of people through e-gates. Some of it's determined by the degree to which people actually have biometric enabled passports. But as the take up of that increases, so does our opportunity to increasingly not just improve the citizen journey by allowing you to flow through e-gates, but it enables us to, if you like, manage the risk of people and goods passing through the borders in a more sensible way. So rather than have everyone be subject to the same sort of checks, we can be a bit cleverer about isolating areas where we know there's higher risk and focusing our resources on those. But it was a good introduction to me that actually, when it comes to thinking about genuinely frontline citizen-facing services and digitizing those services and using data and analytics and AI, governments do have a real opportunity in that space to lead. And I think the UK government is. And that was partly behind my move to NHSX as well at the beginning of this year. To be sure, as with all of these moves, it's a bit push and pull. So I'd been at Home Office by that stage for about 5 years, and I was looking to do something a bit different. I met Matthew Gould, our CEO, and Tim Donahoe, our Chief Operations Officer, and others, and really brought into the goal of NHS and that vision, which is to try and move towards a much more digitally enabled, connected, and transformed NHS and social care system. And a lot of that is around ensuring that data can flow between health and care settings and reimagining some of our care pathways so that we can raise productivity and we can increase and improve the experience of patients and people in care and clinicians, who we can give information at a point of care about the patients they have in front of them, and where we can use digital technology to improve the lives of staff as well. So it's a really exciting vision. And frankly, also the healthcare sector and its just innate complexity also appeal to me. It is a remarkable system of different trusts and commissioning units and GPs and mental health organisations and social care organisations and pharmacists and opticians and all sorts of organisations trying to support each other and improve that whole joined up end-to-end patient care journey. The other great pleasure or excitement about working in government as opposed to private sector organisations is, even if you're working in a very large global bank, a big wholesale bank, and I did a lot of my work as a consultant in those environments, you don't quite have the heft to genuinely shape markets. Whereas in government, you can. There are situations frequently at the Home Office where we would want to stimulate the market to encourage innovation in certain areas that we knew we needed capabilities that didn't yet exist. Biometrics is a good example. And in the healthcare system as well, I think there are examples where certainly there are markets that we know aren't functioning in the way that we'd like in terms of driving towards standards on interoperability and the sharing of data. But there's also enormous opportunities for new healthcare solutions with new technology as well. So we have a real opportunity to invest and drive innovation and the efforts of small and medium enterprises to support that.
No, that's fascinating. How many different suppliers in general do you work with through both, when you looked at the Home Office and NHSX? I imagine it's hundreds of suppliers that are impacted through the supply chains.
Yeah, it is. I mean, clearly, as you mentioned, there's a supply chain thing where each of our suppliers will themselves have a series of suppliers, and in many cases that chain is quite long. But even the direct number of organisations and third-party vendors who we buy from is absolutely enormous. And of course, in the healthcare sector this year, it'll have been magnified due to the emergency response to get support for COVID, both from PPE is something that's been in the headlines, but actually across the board, we've had to work very, very closely with a whole set of providers, both incumbents and new providers. In the Home Office, it was, for various reasons, from a technology point of view, quite a disaggregated environment, because we were trying to move from an operational setup in which we had, if you like, a number of old style legacy end-to-end contracts. And what we were trying to do was disaggregate those, standardize the component services, especially lower down the tech stack in the pipes and plumbing, in the networks, in the infrastructure, in the storage and so on. So we were aiming to disaggregate those and then effectively re-aggregate or consolidate and standardize. But we did have, I think, around probably 300 or 400 unique suppliers in that space. And actually, in NHSX, it's not that high, but it's not far off that, which means that clearly there's a contracting procurement challenge, and obviously, especially that we are constrained by both the benefits and the sometimes the challenges of public sector procurement rules and regulations. But there's also the vendor management problem there as well, and how we extract value from our vendors. And the healthcare system it's a real challenge there, because actually, despite the name of National Health Service, it is a very fragmented system, and we buy at local and trust levels, and sometimes we don't always get the advantage of our enormous weight and power of the NHS, because that's often mediated through lots and lots of local contracts, sometimes with the same sort of providers. So part of the work has got to be thinking about how we better use our buying power.
Yeah, that makes complete sense. So this year is clearly, going to be booked in by the pandemic. I remember sitting in the UK, I think it was on February 17th when I sent the first text, and the numbers were just starting to rise in Italy. As you recall, it was sort of, winter break, lots of people skiing, and there was early signs coming out of Italy on COVID had jumped into Europe. I can't imagine. I know what we went through as a firm, what we went through, the whole industry with work from home and everything. But how did your world change and your role change on sort of mid-February and especially early March when we all started going into lockdown?
Yeah, and so everything changed. In fact, the first week that I joined NHSX, the first day I was in the office, I was told, effectively, drop everything. We're now going to refocus and pivot the organisation to focus just on COVID. And that was the first day in the office. And by the end of that first week, or perhaps the end of the second week, we were all sent home, and I've been working remotely ever since. So my time in the healthcare system has been absolutely dominated by COVID. When did it really hit me? It was probably in that first week, because I do remember probably in early February in the Home Office reading about COVID, but thinking, as I suspect a lot of people did, that this was just something that was going to be a bit SARS-like and possibly wouldn't hit us. And in fact, I remember I had a colleague at the Home Office, and she had been working crazy hours for the previous year because she was involved in our Brexit task force. And she just about managed to keep body and soul together to get to the end of the year, and then the withdrawal bill. And I remember bumping into her in early February, and saying, how are you? And she said, well, thank God I've got a breather now, because I've rotated off from the Brexit team, and I'm now put on this little thing to do with preparing for COVID.
Oh my gosh!
So that's great, because that's going nowhere. You won't have much to do. And I shudder to think what her year's been like. But I think that was up until mid-February, and I certainly on walking into the NHSX offices on my first day, I wasn't expecting the whole year to be dominated by COVID.
Yeah, I would absolutely agree. And I just your first day and facing that, it must have been just shocking. So many things they had to do. One, just, how do you get the standard care? How do you do work from home? All those things that we've talked through as an industry. But one of the biggest challenges was really one, finding out about the virus, protecting lives, protecting folks and things. But track and trace was a major, issue, especially the early days on understanding where people were, how infectious the diseases were, how to make sure that people were safe. Talk a little bit about NHSX's role in rolling out track and trace. And, I think from my perspective, living in the UK at the time, a US citizen, traveling all over the world and seeing it, a magnificent success, really strong. The QCR codes were so well received at pubs and restaurants. I think we had over, I think I saw over 10 million downloads of it. But walk us through the early days of that.
Well, I'm glad to hear you say that, Steve. Again, on my first day in the NHSX offices, I think there was a decision on that first day that we needed, we collectively needed to do something about an app, and that we, NHSX, were going to take the lead on that. So, on my first day, I was speaking to potential vendors, because obviously we wanted to think very hard about the architecture and about standards, but we also knew that we were going to have to work with vendors to build this thing out for us. And I think that we will have contracted within a very short space of time and got a really, creative and really capable set of vendors to help us support and to start building that app out. And I think, what happened? I mean, ultimately, we started build on a, there was a debate about the architecture, and in those early days, we started building on a centralized data platform. Subsequently, Apple and Google announced a different architecture and a more decentralized model, and then we responded to that by effectively developing 2 tracks so that we could work on both of those things simultaneously. And we also tested this thing, I was going to say to death, but I mean tested it in a really, the way you're supposed to test when you're doing agile development. So the word delays to our initial time frame, but a lot of that was precisely because we were learning from testing. We did extensive tests on the Isle of Wight and elsewhere, and we learned as we went along, and this was new ground for everyone. NHSX ended up transferring responsibility for the app to the test and trace team in, don't quote me, I think it's around August. And then, of course, the work on the decentralized version of that was continued and then ultimately launched. But the bulk of the engine there, the bulk of the coding remains the stuff that we commissioned back in March. And I think, as I say, it's a good example of an approach of taking calculated risks. We knew there were risks we were taking, but we pressed ahead and we tested and we responded to the results of our tests. So, as I say, I think given the timeframes and given where we were at the time, I think it hasn't been a bad outcome at all. But clearly, we'll be looking back at ourselves and working what we could have done differently. But as you say, it's now been widely downloaded. I think it's a pretty user-friendly app. There are things about it which are always being improved. There's a good support wrap around it, and I'm pretty proud of the whole of the NHSX team and my own commercial colleagues in supporting that at the outset.
Well, I think you're spot on. I mean, the whole experiment, if you will, was so difficult for every country across the world, quite frankly. Changing standards, how do you really do it? How do you maintain privacy? How do you respect individuals' privacy as you go through it? And clearly, even on the testing side, there was so much that we had to learn so quickly during that period. So, it's always tough to be under the magnifying glass. I think we can all appreciate that. But from a outside in perspective and seeing how many other countries and locales responded, I would give hats off to the team. Really, really great response. And it's just such an easy app to use. It's so straightforward. My wife and I have both used it so many times in and out of the pubs throughout all of England, quite frankly. And it's been quite successful. So very good. So clearly, David, the next step is really the vaccine. So, great news on the vaccine front. Pfizer had a really big approach to that. I know Oxford was knee deep in that. So, the UK government itself was deeply involved in just getting to a vaccine. What do you sort of see as the next steps for NHSX, the rollout of the vaccine, and sort of your role in still, kind of bringing that digital experience, if you will, to healthcare, but also making sure that people are safe as we go forward?
Right. So the vaccination program is a separate thing within within the NHS. But to be sure, there's a lot of digital and technology behind it, including the logistics, the booking, the flows of data, and so on. And so we've had people from NHSX heavily involved in that. Dave Turner, our CTO, for example. But I guess the bulk of work we are trying to drive from an NHSX perspective now are effectively supporting NHS and its response to the second wave. We're continuing to do quite a lot of work to support and scale a lot of stuff we've been doing in terms of creating solutions for remote monitoring, for example, online and video consultations, clinical communications. So we're continuing to scale that. We're trying to now do a lot of work on expanding the provision of shared care records, which is really important for shared care, so that clinicians and other carers have the information, the complete information they need about patients. And increasingly, actually, we've also been looking at how we support social care. So we've rolled out, for example, 11,000 iPads to care homes so that residents in care homes can stay connected. We're trying to create better proxy access for care home staff so they can order medications and appointments for their residents. And we're doing a lot of work there to try and support vulnerable and other isolated groups. So that's probably the focus of what we're now aiming at in NHSX for the next few months.
No, that makes sense. It's interesting because especially with some of the most vulnerable groups, the mental health is really as critical, as important as the physical health in many ways. So rolling out better ways to connect with people is critically important. So great mission there.
And for us, part of it is around that ability to join up the care, because often as an individual, you will have, you'll go to your GP, you'll be referred to a hospital, you might have mental health issues, you might require community support, you might have other issues, and therefore, rather than have a whole series of separate interactions and data that doesn't talk to each other, what's really important to make those user journeys flow is to start opening up systems, start enforcing standards of interoperability and open data flows so that we can make that journey a lot more seamless and smooth for both the patient and the citizen and the carers.
That makes complete sense. What do you see? I don't know what a new normal looks like. I don't know that any of us do. But how do you see sort of the transformation of the NHS going forward, especially if you look sort of a post-vaccine period? And what's next for you?
I don't know. I mean, I think there's got to be a sense in which a lot of the functionality that's been rolled out specifically for COVID is a good thing generally, not just because we've used it to respond to COVID. So our ability to interact more with people in their homes, to do more online and to do more remotely is just a great thing that we'll be wanting to build on. And of course, all of that is technology enabled. So from a tech perspective, that's really crucial that we build on that. From my specific perspective as well, we need to really do a lot of thinking about strategically what our commercial approach is, which is actually, the bulk of my job is not so well. It's partly making sure that the services that NHSX buy or commission, partly that we do that in a compliant way and we have a sensible procurement strategy and approach for that. But it's also to think about how the system itself buys. And the fact of the matter is, we do have a very fragmented buying market, and that's exacerbated to a degree by a whole proliferation of, in many cases, overlapping procurement frameworks. And we often have buying decisions, if you like, made at the wrong level. So what I mean by that is, if you're trying to buy a very complex electronic patient record system, does it make sense to have a trust having to drive that procurement activity when the trust may be making that decision once every 10, 15 years? And so by definition, wouldn't have the experience or capability to do that, whereas we might want to support that centrally, where we can build up more expertise, and we can also do more to assure that the services provided by the market meet the standards we need them to, and intervene if they don't. So there's a real thing there about where we, what we do to consolidate, in some cases, the way we go to market, who pays for things, how we do things right, and also, frankly, where we get out of the way in the centre from where we get out of the way, we just let trusts and local organisations and regional organisations do their own thing, because not all of our interventions are regarded with the same degree of enthusiasm, as you can imagine. So part of this is, as I say, thinking about what those procurement journeys look like and what the appropriate buying units are. And we're trying to do a lot of shifting towards more so-called integrated care systems, where we have local groups of institutions that we're trying to get to group together in many ways to buy. And that will really enable us to start doing some of those things around the join up we discussed earlier.
Well, you are clearly a man that likes big challenges, David. An integrated EMR application or support has been sort of the holy grail of healthcare for years. And from trying to do immigration reform and Brexit to the COVID response to now trying to take on integrated EMR, you've got quite the challenge ahead of you. Let me put it like that. So good. Hey, this has just been absolutely fantastic, David. I so appreciate your time. I'd love to wish you a happy holidays and everything, but I suspect you're going to continue to be working to make sure people remain safe and NHS continues to do their mission over a very difficult period, even with the vaccine. But any final words from you?
No, thanks. Apart from to say, have no fear, I shall certainly be taking a break this Christmas, and by God, I need it. But no,
I would agree.
It has been a wonderful. It's a wonderful place to work, the UK healthcare system. It's such a privilege to work in an organisation where there are so many incredibly talented people, and I've been staggered at the degree to how collegial, helpful, friendly everyone has been in this time, which obviously has been very difficult and stressful for most people. So I'm really, really happy to be here, and I'm looking forward to seeing if we can continue to hopefully make positive interventions in 2021.
Very good. Well, it's an amazing organization. The team has done an amazing job over an incredibly difficult period. So congrats. I hope you do get a little bit of downtime, and we all get through this. So thank you, and I look forward to catching up soon.